So I'm here today at the ASIM 17 conference with Rick Brennan, who's Director of Emergency Operations at the World Health Organization. So Rick's given us a presentation this morning about some of the global challenges in public health and health security. Could you touch on some of the things that you talked about this morning?
Sure. I think we are faced with a number of challenges, but we're also presented with a number of opportunities, and I think we're making progress against some of the challenges. But contextually, we're at a phase right now of unprecedented needs and risks for emergencies from all different causes around the world today. So each year now we see around 200 significant outbreaks globally. Each year over 200 million people are affected by natural disasters and technological disasters. And then at the same time, we have over 130 million people in need of humanitarian assistance around the world, including 65.5 million people who have been forcibly displaced, such as refugees and internally displaced people. And of those 130 million people in need, 80% of that is driven by conflict. So there are a lot of different hazards, if you like, causes of potential disasters, from outbreaks to natural disasters and conflict, and they're all increasing, and the risks that they will occur are also increasing. So we have a lot of challenges, but I think across all those fronts we're also making some progress.
So you talked about some of the things that especially of interest is the pilot you're running in Yemen. Could you tell us a bit about that?
Yeah, well, Yemen's a very difficult operating environment right now. There's been a conflict that's been ongoing for the last 2 or 3 years. It's the country's divided between the north and the south, separate governments in control, and there are over 14 million people in need of humanitarian assistance today, and the health system there is severely underfunctioning. So our old models of providing humanitarian assistance to people in need aren't really working in these protracted conflicts, which have a huge political dimension. So we're coming together with the World Bank and UNICEF and the World Food Programme to ensure access to an essential package of health services to those people in need. And it's very, very, very challenging. A lot of constraints such as insecurity and access and lack of capacity. One of the big challenges is health workers haven't been paid in Yemen, so they're not turning up to the health facilities. The health facilities have been underperforming. So one of our big priorities is to pay the health workers, to get them back into the health facilities, is to rebuild the damaged health facilities, to put in supply chains so drugs can be consistently available and people can re-establish trust in the health system. It won't be easy, but because the World Bank for the first time ever has been involved in this type of operation, there's financial resources on the table for us to use that have never been available before. So we are looking at expanding health services across all areas of the country, both sides of the conflict, and we hope to take this model, particularly if it's successful, to other countries, Syria, Congo, Central African Republic, that also are experiencing protracted conflict.
So you talked a bit about, I guess, some of the risks that you're facing at the beginning of this interview. What are some of the challenges that are standing in the way globally of doing this well?
Well, yeah, I mean, the drivers of risk include climate change, and that's contributing to all different types of emergencies, from outbreaks to natural disasters, severe weather events such as drought and severe storms. But it's also contributing to conflict, as we saw most classically in the conflict in Darfur and Sudan in the last decade. But also it's helping to drive conflicts and huge needs in other areas. For example, the Horn of Africa, Ethiopia and Somalia have just experienced a severe drought and we're on the edge of famine for a long period of time. So that's a big challenge. I think, again, state fragility, the fact that there are a lot of governments that just aren't working right now, and some low intensity conflicts that can exacerbate. And that's contributing to the massive waves of migration that we're seeing globally right now. And that has, the millions of refugees and millions of people who have chosen to migrate because they can't get access to jobs and essential health services in their own countries, and that's putting pressures on the receiving countries as well. There are potential health risks of that. There are societal risks as well. So there's a confluence of issues, but I think that across all these areas, whether it's preparing for outbreaks, whether it's reducing the risks for disasters, whether it's finding new ways to work in difficult conflict settings, we are making progress in a number of those areas, and we're learning our lessons, I think. So it's not all doom and gloom. There's there's always a positive side of this, but we have a collective responsibility. We've still got a lot of work to do, but there's, I think, some good momentum on a number of fronts.
You spoke earlier in the week in another presentation about Ebola, the Ebola outbreak, and particular risks to healthcare workers. I mean, what are we seeing, not just with Ebola, but globally? What are some of the risks that we're seeing to healthcare workers and challenges there?
Right. Well, for these big outbreaks, of course, health workers are on the front line, and we really saw that in the Ebola outbreak, and upwards of 900 health staff in West Africa during the Ebola outbreak developed the disease, and close to 60% of them died. So they were the real heroes of this response. And so that's always a risk in outbreaks. I think in some of the other contexts, the conflict-related settings in which I mentioned, one of the really disturbing trends that we have seen in recent years is deliberate attacks on the health system, targeting of health facilities, targeting of health workers. And we have set up a system to monitor those types of attacks. And over the last 3.5 years, we've identified close to 1,100 of these attacks and over 1,500 deaths. And that really contributes to the destabilization and poor functioning of the health sector. So for example, in Syria right now, less than half of the health facilities are fully functional. Not only are the health workers being attacked, they're leaving. And the next generation of health workers is not being produced in these settings because medical schools and nursing schools aren't working and so on. So, these are some of the challenges that again we're working to find solutions for. We're doing a lot of advocacy to reduce those types of attacks. We're trying to work out best practices that we can keep health services going in the face of those attacks, and we're working with a number of partners on that.
And finally, you talked about public health this morning and the development of a public health network or operations network. Could you talk about that?
Yeah. So I think one of the encouraging developments in emergency management, if you like, is the establishment of emergency operations centres. And these are physical structures, or they're virtual spaces where health professionals working in emergencies can convene for strategically managing and coordinating the response in emergencies. So we use them in outbreaks, we use them in natural disasters, we're increasingly using them now in these conflict settings. And we are developing best practices and standards for these operating centres. They're like the war rooms, if you like, that the President of the United States, the Prime Minister of Australia might have, but with a focus on managing emergencies with health consequences and health emergencies with outbreaks. And we have learnt from other disaster sectors, if you like, the firefighters and other emergency operators, and learned how they manage emergencies, and we're transferring that to the health sector, and it's paying dividends in terms of the effectiveness and the predictability of our response. And
finally, just looking ahead, you sort of mentioned we're in an unprecedented period of pressure, I suppose, for the WHO and like agencies. Could you speak to us about that quickly?
Yeah, well, in terms of the demands and the risks that they are there, I think also for our organisation. I mean, it's on the public record. We were criticised a lot for our underperformance in the Ebola response, and so our organisation, which has specific responsibilities for emergency management in the health sector globally, we've undergone a major reform, and we've done restructures with major restructuring, major processes and systems, and we've got a long way to go. Our new executive director is another Aussie, Dr. Pete Salama from Melbourne, and he's doing a tremendous job. But it's not just about WHO, it's building partnerships, it's building capacities at country level, it's supporting countries and the member states and the people who are on the front line, who are the local health workers. And so a lot of our focus is also developing those capacities, because they're the guys at the coalface. They're the real heroes in these responses. So we have an obligation to support them as well. And our restructuring is seeing how we can better support the country efforts.
Thanks for your time, Rick. Appreciate it.
Thanks a lot. Thank you.
No worries.